another more review. Stitching, remember, stitching is getting that DICOM and the STL to marry up. We're going to do a case in today. One of the cases is a good case because the automatic stitch doesn't go right on. I'm going to show you how to look at it because you got to verify your stitch. And you have to know what you're looking for, because if you don't verify it and you move forward and the stitch was off, your case is all off, right? And sometimes this doesn't matter, but on a high accuracy precision case, it does matter. So I'm going to show you how to verify that it's off and then how to fix it manually. So we're going to actually do that today. I'm going to skip the rest of this here. This is a cool, we haven't talked about this yet. So this is a cool topic. This is called bone segmentation. The word bone segmentation basically means converting a DICOM from your cone beam into an STL. And we'd want to do that for multiple reasons. If you wanted to print somebody's maxilla, well, you can't print a DICOM. A DICOM is not a printable file. But you can convert it into an STL, and then you can go print a maxilla. The other reason we like it is because, how much scatter do you see on these cone beams? And you ever look at the case and you're playing your case, and there's just scatter everywhere from dense bone or zirconia or metal. And it just is, it's hard to really visualize the case and to see the case in action. So I'll tell you, so bone segmentation is the process of converting a DICOM into an STL, and you'll see what that looks like here. But, it used to be, well, you can do it manually yourself in Blue Sky, where you can bone segment. I never even done it because basically, the guys that I've learned from basically say it's so tedious, time consuming, it's not really worth the dentist's time. So when you, yeah, he's done it and he agrees, exactly. So, this is a service that you got to pay for. Now, when would you want this? Well, anytime, if you're trying to design a guide that sits on somebody's maxilla, let's say it's a bone reduction guide. You want to slide it on their maxilla and just take your burr and go whoosh and hack off all the area of bone above that. Well, you have to have an STL of their maxilla in order to build a guide upon. You can't build that on a DICOM. So you have to get this. Now, this is a company called Diagnocat that's really, really cool, because it used to be where we'd have to pay for this and we'd have to wait 3 days for a company to manually go and segment it and get it back to you. And you're sitting there twiddling your thumbs. I can't start my case until I get it back. This is fully AI driven. This is really cool. You guys should go check out this website and set up a little demo with this guy. So Doug is the rep who will do a demo with you guys. And so I went through the demo and saw the software, and I was like, this is cool. So they're a full AI company now that does the bone segmentation, which alone is amazing. But then they do full AI diagnosis and interpretation of an FMX. You can upload a patient's FMX, and it'll give you a full diagnostic report of the caries, the perio, the occlusion, the periapical radiolucencies for every tooth in the mouth. And it's kind of like the future of diagnostic dentistry, where you could just calibrate every dentist and you just print out, oh, hey patient, it says you have this problem with this tooth and you should get this. So it's really kind of the future of dentistry. Obviously, it's not going to be this mainstream thing today, but I think we're headed there really quickly, where AI is helping us and calibrating us and taking out the human error and human biases in diagnosing. So they will literally segment out your entire case. So they'll give you, our cone beam isn't very high volume, but they will give you an STL for the mandible, the nerves, the lower teeth, the upper teeth, the maxilla, literally the airway. Ours doesn't capture the airway, but they will literally give you an STL of the patient's airway, and they're all individual files. So you got your maxilla, your mandible, upper teeth, lower teeth, airway, and then the face. So if your scanner, your cone beam is getting the face, they will convert the face into an STL, and they give you a folder. And it's all done by computers. It's not even, it's not humans that are doing this like it used to be.